Hello and welcome, and good morning, buenos dias. My name is Cristina Caballero. I'm the President and CEO of Dialogue on Diversity. We welcome you to Dialogue on Diversity's 10th year presentation of our Healthcare Symposium. Our theme today is Healthcare in the Good Society. How far have we come? Here is what was discussed today. The legal, institutional, and political aspects of healthcare in America had come to stand at the top of the public agenda for the past several years. The result of the public discussion on these matters is necessarily going to affect each of us from now on. Intense debate has gone on every political forum. It has dealt with a broad range of healthcare questions. The discussions, which have often been heated and contentious, have gone on for some 18 months and longer. A new law is on the books, but lying ahead is a long period for implementation of that law, and no one knows all the problems that may arise along the way. We hope that the expert presentation in today's series of panels may go much of the way in illustrating some of the serious concerns that we have to face and deal with in months and years ahead. For example, small business owners cannot continue to be concerned over the new law's rules on employee health insurance. They hope that a new system of subsidies will permit them to provide decent medical insurance coverage for the people who work for them and for their own families. Individual households have their own set of worries. Sudden sickness or accident can knock them out of their employment, and in the past, the task of arranging their own insurance has proved next to impossible. The new law proposes to fix this problem by offering these individuals and their families full coverage and at reasonable premium rates, without regard to one's present or past condition. Next, the new law has directed both attention and funding to the questions we have for long been raising, those relating to cultural competency, the difficult task of bringing up-to-the-minute medical care to persons of different cultures and ethnic traditions, people who often do not understand the language of the doctors and the meaning of the proposed treatments. Again, we need to remind ourselves, our colleagues, and our families and friends of the threats of several major sicknesses, the commonest health threats that we must be on the lookout for, and that we can often prevent by sensible and alert lifestyle practices. Our expert in a roundtable closing the afternoon's session of today's symposium will deal the symptoms and the preventive steps and the treatments that cutting-edge medical science dictates for cancer, kidney disease, geriatric disorders, and other ills. At lunch, we have recognized Kaiser Permanente with our Corporate Healthcare Award received by Monica Villalta, Director of Diversity Programs. We also were pleased to have with us the Honorable Raymond Joseph, Ambassador of Haiti, the Honorable Garth Graham, Deputy Assistant Secretary of Minority Health, Department of Health and Human Services, Dr. John K. Andrews, Deputy Director, Pan American Health Organization, and Yvette Fernandez, Director for Advocacy of the Northeast region in Pfizer. Finally, our program culminated in a recognition of two figures in the local Washington, D.C. area. Two honorees whose career have exemplified service to others of our neighborhood and our metropolitan community. Among them is Rodrigo Leiva of the Latino Federation of Greater Washington, D.C., and Betty Baca, long distinguished leader in our community. We look forward to seeing you later in the year on July the 14th in our presentation of Dialogues on Diversity's Entrepreneurship IT Conference, which will take place at the Visitor Centers in Congress in Washington, D.C. Thank you, and God bless you all.